Welcome to the Global RPH review video. Dr. Dave and I will be releasing several videos this week. Every decade brings a breakthrough in insulin therapy. The last few years since 2021 mark one of the most important periods of innovation in diabetes treatment history. New insulin formulations, smart delivery systems, and precision dosing approaches have altered the map of diabetes management. These advances are vital for people with type 2 diabetes who find it hard to follow traditional insulin regimens. This detailed piece explores the latest developments in insulin therapy since 2021. We cover everything from ultra-rapid acting insulins to weekly basal analogs. The molecular mechanisms, dosing strategies, and practical implications of these new treatments are the foundations of better care. Healthcare providers and people managing diabetes need to understand these innovations to achieve the best treatment outcomes. The medical world has changed dramatically since researchers first found insulin in 1921. This remarkable experience has turned diabetes from a fatal diagnosis into a condition people can manage effectively. The last few years have brought extraordinary advances in insulin therapy. VX-880, a stem cell-derived therapy, showed great promise in 2021. The first patient who received this treatment needed 91% less daily insulin after just 90 days. New insulin delivery methods are revolutionizing treatment options. Weekly insulin formulations are becoming game changers, with two notable developments: insulin icodec and basal insulin BIF. These weekly formulations reduce variability and lower hypoglycemia risk compared to daily insulins. Let me share some exciting breakthroughs in insulin formulations that are revolutionizing diabetes management. Research reveals three major developments that have altered the map of diabetes treatment. Ultra-rapid acting insulins. Ultra-rapid acting insulins are a major breakthrough. These formulations offer faster glucose control, improved postprandial management, and greater flexibility around meal timing. Lyumjev is a faster version of Humalog. Lyumjev is the only ultra-rapid acting insulin that is approved for children with diabetes. It can be taken up to 20 minutes after starting a meal, but it is recommended to take it before the meal when possible. Fiasp, an insulin aspart that is a faster version of Novolog. Afrezza, an inhaled insulin powder that is made of insulin human. Ultra-rapid acting insulins can lower glucose levels more quickly than other rapid-acting insulins, which generally take about 30 minutes to work. Ultra-rapid acting insulins can lower glucose levels within about 12 to 20 minutes. The progress in ultra-rapid insulin development looks remarkable. Our observations show these key benefits: faster glucose control with onset in 10 to 20 minutes. Peak effectiveness reached in 90 minutes. Improved postprandial glucose management. Greater flexibility around meal timing. Weekly basal insulin analogs. One of the biggest breakthroughs comes from two weekly insulin formulations. Novo Nordisk's insulin icodec shows promising results in the Onwards clinical trials. The steady-state coverage maintains after 3 to 4 weekly injections. The second option, basal insulin FC, BIF, combines a novel single-chain insulin variant with a human IgG-Fc domain. Clinical trials show BIF delivers similar glycemic control to daily insulin, with a treatment difference of just 0.06%. Smart insulin technologies. The sort of thing I love about smart insulin technologies is how they represent the next frontier in diabetes management. These glucose-responsive insulins stay inactive until blood glucose levels rise. A fascinating cage-like structure detects varying glucose levels and releases insulin as needed. Recent trials show this smart insulin formulation responds well to blood glucose changes and reduces dangerous hypoglycemic events. Better yet, the dosage stays active for 3 days, substantially extending current insulin formulation's duration. Smart insulins tackle the biggest problems of current insulin therapy: biocompatibility, degradation of delivery materials, and precision of dosing. Research shows these new formulations could revolutionize type 1 diabetes management by providing more precise glucose management, eliminating hypoglycemia risks, reducing the need for constant glucose monitoring. URLI, ultra-rapid Lispro, shows especially promising results with faster insulin absorption and better postprandial glucose reduction. Molecular basis of new insulin types. Modern insulin analogs achieve their improved action through specific molecular modifications. The latest ultra-long-acting insulins, like insulin degludec, show 4 times lower day-to-day variability in glucose-lowering effect compared to traditional formulations. Our research highlights several key molecular advances. Added fatty acid chains bind to albumin, amino acid substitutions create stability, and modified isoelectric points enable controlled release. Receptor binding and signaling pathways. The insulin signaling process starts with an amazing cascade of events. The insulin binding to its receptor triggers trans-autophosphorylation and activates 2 main pathways. The PI3K/AKT pathway creates metabolic effects, and the RAF/RAS/MEEK/MAPK pathway drives gene expression. Studies show that the insulin receptor exists as a covalent disulfide-linked dimer even before insulin binding. The sort of thing I love is that only one insulin molecule binds to the receptor dimer with high affinity. Pharmacokinetic improvements. Insulin glargine U300 maintains glucose control for approximately 5 hours longer than its predecessor. Clinical observations reveal insulin degludec's remarkable duration, with glucose-lowering effects lasting at least 42 hours after the final injection in an 8-day treatment course. Time action profiles. Clinical observations show that effective insulin dosing depends on consistent eating patterns. We have built a complete understanding of time action profile variations. These profiles reveal that ultra-rapid insulins show onset within 4 to 6 hours, basal insulins demonstrate a 24-hour steady-state profile, and pre-mixed formulations exhibit dual-action characteristics. Individual response factors. Patient-specific factors influence insulin effectiveness in clinical practice. Recent studies show that dose exposure and exposure-response relationships can vary dramatically, even with similar dosing. Precision dosing becomes vital when dealing with drugs that have narrow therapeutic windows. Biomarker-guided dosing emergence excites us. Research shows that biomarkers are the foundations of patient selection, toxicity monitoring, and dose selection guidance. Modern technology helps us track these markers better than ever before. Multiple factors shape our precision dosing strategies. These include organ function, genetic variants, and disease state characteristics. This all-encompassing approach guides us toward better outcomes in type 2 diabetes management. Technological integration. The digital world has revolutionized diabetes management and changed our approach to insulin delivery and monitoring. Smart devices and automated systems are working together to reshape patient care in ways we never imagined. Smart insulin pens. Smart insulin pen technology has made remarkable progress. These devices now connect through Bluetooth and offer advanced tracking features. Research shows these pens solve 3 main challenges: dose amount calculation, timing precision, and temperature and storage monitoring. The sort of thing I love about these smart pens is their ability to prevent insulin stacking through active insulin tracking. This feature substantially reduces hypoglycemia risks. These devices can remember insulin doses and timing automatically and combine smoothly with continuous glucose monitoring systems. Digital dose tracking. Digital tracking systems have completely changed diabetes care through complete data integration. Smart pen platforms give us unmatched insight into treatment patterns and store insulin doses automatically. Digital tracking systems benefit both patients and healthcare providers greatly. Research shows patients who miss insulin doses tend to have worse glycemic control. Smart pen users show better dosing habits and improved glycemic results. This technology integration marks a huge step forward in diabetes management. Automated systems can now give correction doses as often as every 5 minutes if needed. Smart pens help prevent missed doses by sending timely reminders and alerts. Hypoglycemia risk assessment. The largest longitudinal study reveals that intensive insulin therapy leads to more severe hypoglycemia cases when HbA1c drops to less than or equal to 7%. Clinical trials highlight these risk factors: prior severe hypoglycemia episodes, age, both under 5 and elderly, renal disease, malnutrition, coronary heart disease, and liver disease. The results from recent trials with newer insulins like icodec look promising. We recorded just 0.53 hypoglycemic events per patient year compared to 0.46 events with traditional insulin glargine. Drug interactions. Research shows that drug interactions create major challenges in insulin therapy. We found 387 different medications that can interact with regular insulin. These interactions fall into 3 categories: medications affecting blood glucose levels, such as antipsychotics and beta blockers, drugs affecting insulin sensitivity, like corticosteroids, and compounds altering insulin metabolism. The biggest problem is that 58% of patients worry about adverse drug interactions. Glucocorticoids disrupt insulin therapy, especially when patients need a 10 to 20% increase in normal insulin dosage. Long-term effects. Intensive insulin therapy can lead to weight gain, and some patients develop metabolic syndrome in 30 to 40% of cases. Recent studies show that insulin-treated patients face higher mortality rates as treatment median HbA1c decreases from 7.5% to 6.4%, with an adjusted hazard ratio of 1.52. Data points to higher cancer rates in type 2 diabetes patients, specifically pancreatic cancer, hepatobiliary cancer, colon cancer, and breast cancer. We have a long way to go, but we can build on this progress with newer insulin formulations. Modern analogs used with metformin show lower risks of cardiovascular events, cancer, and all-cause mortality. Patient-specific factors. Clinical practice shows that successful diabetes management needs a deeply personal approach. Patient populations are diverse, and no single solution works for everyone. Age-related considerations are, vital when it comes to diabetes treatment outcomes. Younger patients need stricter A1C goals because they face longer exposure to hyperglycemia and higher complication risks. Research indicates that early intensive glycemic control reduces complication rates over time. This creates what medical professionals call the legacy effect. Older patients, on the other hand, require a different strategy. A diagnosis later in life often comes with coexisting conditions and shorter life expectancy. This leads doctors to set more flexible A1C goals. Type 2 diabetes affects more than 20% of adults over 75 years, making this approach essential. Comorbidity impact is another key consideration. Clinical experience reveals how other health conditions make diabetes management more complex. Most adults with diabetes have at least one chronic disease, and about 40% live with 3 or more. Several key factors come into play. Physical limitations from conditions like arthritis, mental health challenges, especially depression, end organ dysfunction, cardiovascular complications, and cognitive impairment. These conditions directly influence glycemic control strategies. Coexisting conditions might reduce life expectancy or increase treatment side effect risks. Clinical implementation. Clinical protocols for insulin therapy have changed substantially over the last several years. Our extensive experience in diabetes management has helped us develop detailed approaches that connect theoretical knowledge with practical application. Treatment algorithms. Successful insulin therapy needs systematic, evidence-based algorithms. Research shows that doctors often delay the initiation and intensification of insulin in patients with type 2 diabetes because of limited acceptance. This leads to suboptimal treatment outcomes. We address this challenge with innovative treatment strategies that include less frequent dosing schedules, non-injectable administration options, simpler complex regimens, and merged insulin pen technologies. Research shows that glycemic management with conventional insulin therapy typically needs treatment intensification with either multiple daily injection or continuous subcutaneous insulin infusion. CSII reduces the need for daily subcutaneous injections because the infusion site needs changing only every 48 to 72 hours. Monitoring protocols. The American Diabetes Association and Society of Critical Care Medicine recommend monitoring fingerstick blood glucose every 1 to 2 hours in patients receiving insulin infusion. Each blood glucose check takes about 7 minutes of nursing time. This includes measurement, recording, and intervention. These findings helped us develop quicker protocols while maintaining safety standards. Research identified several significant barriers to protocol implementation. Ambiguity in glycemic control targets, low nurse-to-patient ratios, practitioner resistance to change, and limited organizational and financial support. Conclusion. Breakthroughs in insulin therapy have changed diabetes management from weekly basal analogs to smart insulin technologies and precision dosing approaches. Smart delivery systems work with digital tracking to enable precise dosing and monitoring. New formulations like insulin icodec and ultra-rapid-acting insulins give patients more flexibility and better glycemic control. Each patient's specific needs guide treatment choices, while safety stays the focus through careful monitoring of hypoglycemia risks and drug interactions. Research and clinical experience show that successful implementation needs systematic treatment algorithms, complete healthcare provider training, regular protocol updates based on new evidence, and a strong emphasis on each patient's factors. Future developments in insulin therapy will boost diabetes management. Weekly dosing options and automated delivery systems could help improve treatment adherence and outcomes while delivering the best care that matches each patient's unique needs and situation. If you enjoyed this video, please subscribe to the new Global RPH YouTube channel.